As the years advance, many believe that taking care of health means adding more and more supplements to their routine. But what almost nobody says is that after 65 years of age, and actually at any stage of life, some of these substances can bring more risks than benefits. The body changes, becomes more sensitive, more vulnerable to excesses that go unnoticed, and that's precisely where a silent danger lies. At this stage, it's not the quantity of supplements that protects. It's the wisdom of knowing which ones truly matter and when they are, in fact, necessary. I am Dr. John Queiroz, and my name carries the weight of 2 decades dedicated to clinical nutrition, pharmacology, and metabolic biochemistry. I've worked in research laboratories, university hospitals, specialized clinics, and most importantly, I've had deep conversations with thousands of people who believed they were doing the best for their health by consuming multiple supplements daily. What I'm going to share with you today doesn't come from passing opinions or internet trends. It comes from careful analysis of robust scientific evidence, observation of concerning clinical patterns, and above all, understanding how our bodies truly function at the molecular level. I need to begin this conversation with a statement that may sound strange, perhaps even counterintuitive, but one that has the power to completely transform your relationship with health. Taking multiple vitamin and mineral supplements without proven necessity not only wastes your money, but may be silently harming your organism in ways you would never imagine. And this isn't cheap alarmism. It's biochemical reality backed by decades of research and thousands of scientific studies that the billion-dollar supplement industry prefers you don't know about. You probably grew up hearing that vitamins are always beneficial, that more is better. The idea that something natural like a vitamin could be harmful seems absurd at first glance. After all, they're substances our bodies need, right? How could they harm us? But here's what we're rarely told. The dose makes the poison. Even water, a substance essential to life, can be lethal in excessive amounts. And vitamins, minerals, and other supplements follow exactly the same principle. For years, the message hammered into our culture has been simple and seductive. Supplements are safe, natural, preventive, and essential for optimal health. The supplement industry moves more than $150 billion globally, with exponential growth each year. Pharmacy shelves display hundreds of colorful bottles promising energy, strengthened immunity, longevity, mental clarity, radiant skin, strong bones, and practically any other imaginable benefit. Celebrities endorse them, influencers promote them, and even some health professionals routinely recommend them. But there's a fundamental problem with this narrative. For the vast majority of people with minimally adequate nutrition, these supplements are not only unnecessary, but may be creating dangerous imbalances, overloading vital organs, and ironically, increasing risks of diseases they're supposedly meant to prevent. Throughout this narrative, I'll reveal the 3 major risk domains rarely discussed openly: cumulative toxicity, dangerous imbalances and interactions, and the phenomenon of false sense of security. I'll explain exactly how excess vitamins can damage the liver and kidneys, how unbalanced minerals interfere with crucial metabolic processes, how supplements interact dangerously with common medications, and how relying on pills can divert attention from the true pillars of health. Most importantly, I'll show when supplements are genuinely necessary, how to identify real needs versus manipulative marketing, and how to build true health through choices that actually work. But before we dive deeply, I need you to make a promise. Promise that you'll read this complete narrative with an open mind, that you'll resist the temptation to dismiss information simply because it contradicts what you've always heard, and that you'll share this knowledge with those you love. Because if there's something I've learned in these decades of practice, it's that information without action is sterile curiosity. And what we're going to discuss here has the potential to save not only your money, but your health. There's a question we rarely ask ourselves when opening a bottle of supplements. Does my body really need this? Will this pill help or harm me? This apparently simple question hides fascinating and concerning complexities that we need to explore together. To understand why supplements can be problematic, we first need to comprehend what vitamins and minerals are and how our bodies use them. Vitamins are essential organic compounds that our organism cannot produce in sufficient quantities, needing to obtain them through food. There are 13 essential vitamins, A, C, D, E, K, and the 8 B-complex vitamins. Each performs specific and crucial biochemical functions. Vitamins are divided into 2 fundamental categories, fat-soluble and water-soluble. This distinction is absolutely critical to understanding the risks. Fat-soluble vitamins, A, D, E, K, are stored in fatty tissues in the liver. They accumulate in the body over time. This means that excessive consumption isn't simply eliminated in urine, as many believe. On the contrary, these vitamins accumulate progressively and can reach toxic levels. Water-soluble vitamins, B-complex and vitamin C, are generally considered safer because excesses are eliminated by the kidneys. But even this safety has important limits. Massive doses overload the kidneys. Some specific types of B vitamins can cause neuropathies at elevated doses, and megadoses of vitamin C can cause gastrointestinal problems and increase the risk of kidney stones in susceptible individuals. Minerals are equally essential inorganic elements: iron, calcium, magnesium, zinc, selenium, iodine, among others. They participate in countless processes, from bone structure to enzymatic function, nerve conduction, muscle contraction, and hormonal regulation. But here's the crucial point: minerals exist in delicate balances. Excess of one can interfere with the absorption or function of another, creating secondary deficiencies that would never exist without supplementation. Our bodies are extraordinarily sophisticated at regulating nutrient absorption when they come from food. If your iron stores are adequate, your intestine reduces absorption of dietary iron. If you need more calcium, it increases absorption efficiency. These regulatory mechanisms evolved over millions of years to maintain homeostasis. But when you ingest concentrated doses in supplement form, often in quantities we would never encounter in nature, these mechanisms are overloaded or completely bypassed. Consider vitamin A. In foods, it comes mainly as beta-carotene, a precursor that your body converts to active vitamin A as needed. Your organism has fine control over this conversion. But supplements often contain preformed vitamin A, retinol, which enters the system directly without conversion regulation. The result can be toxic accumulation much more easily than would ever occur through diet, even if you ate carrots obsessively. This fundamental distinction between nutrients in foods versus isolated supplements is constantly ignored by supplement marketing, which treats vitamins as if they were universally beneficial regardless of source or dose. But the biochemical reality is radically different. Let's dive into the first major risk domain: direct toxicity caused by excessive accumulation of vitamins and minerals. We'll start with vitamin A because it perfectly illustrates the dangers of indiscriminate supplementation. Vitamin A is absolutely essential for vision, immune function, reproduction, and cellular communication. But in excess, it's hepatotoxic, literally toxic to the liver. Hypervitaminosis A causes a condition called vitamin A-induced hepatotoxicity, which can progress to hepatic fibrosis and even cirrhosis in severe cases of prolonged excessive consumption. Symptoms include fatigue, nausea, abdominal pain, jaundice, and in the most severe cases, liver failure. The recommended daily dose of vitamin A for adults is around 700 to 900 micrograms. Many multivitamin supplements contain 100% or more of this recommendation. If you also consume fortified foods, other specific supplements, and occasionally eat liver, extremely rich in vitamin A, you can easily exceed safe levels chronically without realizing it. And because vitamin A accumulates in the liver, effects don't appear immediately. They're insidious, progressive, often erroneously attributed to other causes. Vitamin D, celebrated as a modern panacea, presents similar risks when consumed excessively. Hypervitaminosis D causes hypercalcemia, excess calcium in the blood. This leads to calcification of soft tissues, including kidneys, heart, and blood vessels. Kidney stones, deteriorated renal function, cardiac arrhythmias, muscle weakness, mental confusion, and bone pain are documented consequences. Severe cases require hospitalization and can cause irreversible kidney damage. The cruel paradox is that people often supplement vitamin D in extremely high doses based on internet articles or non-professional advice, seeking immunological or bone benefits, but end up creating problems much more serious than any mild deficiency would cause. Vitamin E at elevated doses has been associated in multiple studies with increased risk of hemorrhagic stroke. The mechanism involves its anticoagulant action. At normal physiological doses, this isn't a problem. In supplement megadoses, especially combined with other anticoagulants, aspirin, prescribed medications, or other supplements like fish oil and ginkgo biloba, the risk increases substantially. Iron is another mineral where the line between sufficiency and toxicity is dangerously narrow. Hemochromatosis, iron overload, can be caused by excessive supplementation in people who don't have deficiency. Excess iron deposits in vital organs, liver, heart, pancreas, causing progressive oxidative damage. This can lead to cirrhosis, heart failure, diabetes, and skin hyperpigmentation. Men and postmenopausal women are particularly vulnerable because they don't have menstrual iron loss to eliminate excesses naturally. The liver and kidneys are central organs in this discussion because they're primarily responsible for metabolizing and eliminating substances. When you overload your body with supplements, you're forcing these organs to work overtime continuously. Over time, this contributes to functional deterioration, chronic inflammation, and potentially disease. The alternatives are clear and scientifically sound. The vast majority of people obtain all necessary vitamins and minerals through varied and balanced diet. Fruits, vegetables, whole grains, legumes, nuts, seeds, quality proteins. These foods provide not just isolated vitamins, but complete nutritional complexes with cofactors and bioactive compounds that work synergistically. Your body recognizes and processes nutrients from food in a fundamentally different and safer way than isolated supplements. The second major risk domain involves something less obvious but equally problematic: imbalances caused when minerals interfere with each other and dangerous interactions between supplements and medications. Minerals don't exist in isolation in the body. They constantly interact, compete for absorption, regulate each other. Supplementing one mineral in excess often creates deficiency of another, even if your intake of that other mineral is adequate. Classic example: zinc and copper. Zinc is popular in immune supplements, especially during flu and cold seasons. But zinc at elevated doses dramatically interferes with copper absorption. Copper deficiency caused by excess zinc results in anemia, neuropathies, connective tissue problems, and immune compromise. Ironically, the opposite of what people sought by taking zinc to strengthen immunity. Calcium, magnesium, and phosphorus also exist in delicate balance. Excessive calcium supplementation without adequate magnesium can contribute to vascular calcification, muscle cramps, constipation, and even increase cardiovascular event risk in some studies. Magnesium, often deficient in modern diets, becomes even more deficient when calcium is supplemented excessively without attention to balance. Iron interferes with zinc and calcium absorption. Calcium interferes with iron absorption, and some medications like tetracycline-class antibiotics. Taking them simultaneously invalidates medication efficacy, prolonging infections. Many people have no idea about these interactions. Now let's consider interactions with medications, an extremely dangerous terrain where natural supplements cause serious problems. Vitamin K interferes with anticoagulants like warfarin, used by millions to prevent clots. Patients who supplement vitamin K or eat inconsistent quantities of foods rich in it, leafy green vegetables, experience unpredictable fluctuations in medication efficacy, increasing risk of both clots and bleeding depending on the direction of imbalance. Vitamin E, fish oil, garlic, ginkgo biloba, and various other supplements have anticoagulant properties. Combining them with each other or with anticoagulant/antiplatelet medications multiplies bleeding risk, including serious gastrointestinal bleeding and hemorrhagic stroke. St. John's wort, a popular mood supplement, is a potent inducer of hepatic enzymes that metabolize drugs. This means it accelerates degradation of multiple medications, including oral contraceptives, leading to unplanned pregnancies, antidepressants, cardiac medications, post-transplant immunosuppressants, and antiviral drugs. Patients take their prescribed medications regularly, but they're metabolized so rapidly due to the supplement that blood levels become subtherapeutic. Calcium and iron must be taken separately from thyroid medications, levothyroxine, because they drastically interfere with absorption, making treatment ineffective. People with hypothyroidism who supplement calcium or iron indiscriminately often have difficulty achieving adequate thyroid hormone levels, leading to unnecessary dose adjustments or medication changes when the real problem was simply inadequate administration timing. Antioxidants at elevated doses, vitamins C and E, beta-carotene, can interfere with chemotherapy and radiotherapy efficacy in cancer patients. The mechanism is that these therapies work partially through generation of free radicals that damage cancer cells. Excess antioxidants can protect cancer cells too, reducing treatment efficacy. The alternatives are again clear. Before adding any supplement, especially if you take medications, consult a qualified professional who knows about interactions. Pharmacists are particularly valuable here because their core expertise is precisely pharmacology and drug interactions. Keep a complete and updated list of everything you consume, prescribed medications, over-the-counter medications, and supplements, and share it with all professionals caring for you. The third risk domain is perhaps the most subtle but potentially the most harmful long-term. Supplements create the illusion that we're adequately caring for health when we're actually neglecting the true fundamentals. Psychologically, consuming multiple supplements daily gives the sensation of doing something for health. This sensation is comforting, but it can create unconscious license to neglect behaviors that truly make a difference: quality nutrition, regular exercise, adequate sleep, stress management, meaningful social connections. Research in behavioral psychology reveals a phenomenon called moral licensing. When we do something we perceive as virtuous, we unconsciously feel licensed for less virtuous behaviors in other domains. Applied to health. I took my supplements today, so I can eat fast food or skip the gym. Of course, this is rarely conscious or verbalized, but it operates at the level of daily decisions. Studies demonstrate that people who regularly consume supplements don't necessarily have better health outcomes than people with adequate nutrition without supplements. In some studies, regular supplement consumers even display less healthy behaviors in other domains, possibly reflecting this unconscious moral licensing. The fundamental truth about health is that there's no magic pill. Health is built through consistent patterns of behaviors that mutually reinforce each other. Diet rich in whole plants, quality proteins, healthy fats, and minimally processed provides not just vitamins and minerals, but fiber, phytonutrients, natural antioxidants in proportions and combinations that science is only beginning to understand. Regular exercise cannot be replaced by any supplement. Its benefits go far beyond any isolated nutrient. Cardiovascular improvement, muscle strengthening, bone density, insulin sensitivity, mental health, cognitive function, sleep quality, longevity. No combination of pills replicates this. Adequate sleep regulates hormones, consolidates memory, allows tissue repair, regulates appetite and metabolism, strengthens immune function. Chronic sleep deprivation cannot be compensated with energy supplements or B vitamins. Stress management through practices like meditation, mindfulness, exercise, social connections, or therapy impacts health in profound ways. Reduces chronic inflammation, improves immune function, regulates blood pressure, protects against cardiovascular diseases and cognitive decline. No stress supplement substitutes these practices. When we deposit health hope primarily in supplements, we divert attention, energy, and financial resources from investments that would truly transform our health. Worse still, we may delay seeking appropriate medical care when symptoms appear, assuming that I'm taking all the vitamins, so it can't be anything serious. The alternatives are fundamental and transformative. Build health from bottom to top, not top to bottom. Invest first in quality nutrition. Prioritize daily movement. Protect your sleep as a non-negotiable priority. Cultivate meaningful relationships. Develop stress management practices. These are the solid foundations on which genuine health is built. Balancing everything we've discussed, it's absolutely crucial to recognize that supplements have legitimate and important places. The problem isn't supplementation itself, but indiscriminate supplementation without proven necessity. Situations where supplementation is clearly indicated include deficiencies diagnosed through laboratory tests, specific conditions that compromise absorption, celiac disease, Crohn's disease, ulcerative colitis, bariatric surgeries, restrictive diets that eliminate food groups, vegans need B12, people with lactose intolerance may need calcium and vitamin D, pregnancy and lactation, folic acid, iron, often prenatal vitamins, certain medications that deplete specific nutrients, metformin, reduces B12, proton pump inhibitors reduce magnesium and B12, aging when absorption naturally diminishes, and specific medical conditions under professional supervision. The crucial difference is, in these cases, supplementation responds to identified need, not vague anxiety or persuasive marketing. It's prescribed and monitored by qualified professionals. Dosages are appropriate, not arbitrary megadoses. And there's follow-up to evaluate efficacy and adjust as necessary. Practical actions, what to do from now on. First, make a complete inventory of all supplements you consume. List each one, daily dose, reason you started taking it. Second, question each supplement. Do I have a diagnosed deficiency of this nutrient? Do I have a medical condition that justifies supplementation? Or did I start based on advertising, fear, or non-professional recommendation? Third, schedule a consultation with a qualified professional, physician, nutritionist, or specialized pharmacist to review your list. Request laboratory tests if there's suspicion of real deficiencies. Discuss interactions with your medications. Fourth, for supplements without clear justification, consider supervised gradual discontinuation. Don't stop everything abruptly if you've been taking them for years without consulting a professional, but plan a sensible transition. Fifth, redirect financial resources spent on unnecessary supplements to quality foods. Organic vegetables, varied fruits, quality proteins, whole grains. These investments have incomparably superior returns. Sixth, educate yourself about nutrition through reliable sources, not supplement marketing. Learn which foods are rich in nutrients you value. Seventh, prioritize the fundamental pillars. 7 to 9 hours of sleep, regular exercise, diet based on whole plants and quality proteins, stress management, social connections. Eighth, be skeptical of extraordinary promises. If a supplement promises radical transformation without effort, it's marketing, not science. Ninth, share this knowledge with those you love. The supplement industry is powerful and persuasive. Evidence-based information is the best defense against manipulation. We've reached the end of this journey through the complex and often confusing world of supplements. The central message isn't that supplements are inherently malignant or should never be used. The message is that indiscriminate supplementation, based on fear, marketing, or false belief that more is always better, creates real health risks while diverting attention and resources from investments that would genuinely transform well-being. There's profound beauty in simplicity. Our ancestors didn't have access to pharmacies full of supplement bottles, but when they had access to adequate and varied nutrition, they thrived. Their bodies were nourished by whole, complex, complete foods, not by isolated nutrients in superphysiological doses. The modern supplement industry has created anxiety where it shouldn't exist, promising solutions where the problem is often manufactured. But you have the power to resist this narrative. Power to make informed choices based on evidence, not fear or marketing. True health doesn't come from bottles. It comes from consistent daily choices that honor your body's extraordinary complexity. It comes from real foods, regular movement, adequate rest, genuine connections, and meaningful purpose. These are the irreplaceable foundations of well-being. If this narrative changed your perspective on supplements, I ask that you leave a comment sharing how many supplements you consume daily and whether you plan to reevaluate this routine. Your account can inspire others to question their own practices. Share this content with family and friends who believe they're doing everything right by consuming multiple supplements. And subscribe for more honest conversations about evidence-based health, not marketing. Remember, your body is an evolutionary masterpiece, fine-tuned over millions of years. Trust its wisdom when you nourish it appropriately. Question the narrative that you're fundamentally deficient and need constant pharmaceutical intervention to function properly. In the vast majority of cases, when we provide the right fundamentals, quality nutrition, movement, rest, connection, the body flourishes without need for excessive supplementation. May this narrative be a catalyst for a wiser, more balanced, evidence-based relationship with your health. Less can genuinely be more when we focus on what truly matters.